policy surveillance systems are great. We want to be able to track changes in policy over time, but they really aren't all that useful unless we have other surveillance systems which are measuring our outcomes, whether the outcome is alcohol consumption or substance consumption, or the consequences of overuse of any substance. But before we get into some of those systems, there is some terminology you should be familiar with because there's different ways to do outcome surveillance. One is active surveillance, when staff actually goes out into the field to find a disease. They may go door to door, they may do phone calls, but in some sense they're going out and actively trying to collect data. There are passive surveillance systems, which are reporting systems. So rather than staff from an organization going out and collecting data, they essentially wait in a passive manner for data to come to them. There are syndromic surveillance systems where instead of trying to identify a specific disease, so say alcohol use disorder, you try to identify symptoms associated with the disease. And then there are sentinel surveillance systems, which are used when resources are limited. So in these systems, rather than trying to find all cases of disease or try to cover all areas, monitor all areas where the cases could occur, you identify a small number of sources to focus on, and any changes in your outcomes in those small number of sources, you assume indicates any changes in disease status of the population as a whole. Now, again, there are many types of surveillance systems, and there are many ways that these are put into practice. So your classic surveillance systems are the active, passive, syndromic, and sentinel surveillance systems. Active surveillance systems that we typically use in addiction science here in the United States would be the NSDUH, the National Survey for Drug Use and Health, which annually surveys tens of thousands of people on their drug use habits. The Monitoring the Future study is another active surveillance system where instead of surveying adults like the NSDUH, they're actually surveying high school students. I think it's 8th, 10th, and 12th graders. And then you have the NHAP. I'm not going to try to pronounce that acronym, but that focuses on hospitals and emergency departments and those systems. That's actually a passive surveillance system. It's actually a passive sentinel surveillance system, so there's some combination there, where some hospitals and some emergency departments are selected to report data back to a central source about the types of people who show up to the emergency room, why they're there, what they're diagnosed with, and whether they were admitted to the hospital or not. Now, I do want to mention that there are some relatively novel ways to detect disease outcomes. One is using Google, not doing the search itself, but actually using the search results. Identifying what other people are searching for is actually a very informative way to determine what disease they're most interested in. The same is with social media. So people love to post information on social media. They probably love to post it a little bit too much. But when they geotag a post, when they geotag a post, which puts latitude and longitudinal numbers on their post, so we know their relative position when they made that post with that information, we can see what parts of a country or what parts of the world are talking about which diseases. And we can actually monitor and in some cases even predict epidemics of different diseases before traditional classic surveillance systems will pick them up. So here's a non-addiction example of how social media can be used to track disease. So this is a study that was done in Sao Paulo, Brazil, largest city in Brazil as far as I'm aware. And they broke the city down by neighborhood. And they tracked the number of dengue fever cases, which can be a very serious illness if it's contracted, by neighborhood, which is the left side of the screen. And you can see the dark blue neighborhoods are where there were the most cases. They also tracked the number of tweets on Twitter that were talking about dengue fever in the city by neighborhood. And again, you can see there's very good overlap between the dark neighborhoods for the dengue fever cases as well as the dark neighborhoods for the dengue tweets. There's a very strong correlation. So this is one example where we can use, outside of addiction, where we can use social media to track a disease, an epidemic of disease as it's occurring or even before. Now, we also do this for addiction, or we can do this in addiction science. This is an example of where they were looking to see if marijuana laws were impacting essentially consumptive behaviors. But since they couldn't measure consumption itself, they were seeing if marijuana regulation influenced the number of people who talked about using marijuana. Again, on Twitter, it seems to be one of the more accessible social media platforms out there for this type of research. So the colored states, the dark states, the yellows, the oranges, and reds, are the states where a greater percentage of Twitter users were talking about marijuana. And you can see that they also categorize the states by the different types of marijuana regulation at the time. So you have some states, as well as the District of Columbia, that legalized recreational marijuana use, others that just have medical marijuana use. And in general, there does seem to be some correlation between having at least recreational marijuana use and increased talking about marijuana consumption on Twitter. So this may be predictive, and we still need a few more studies to demonstrate that maybe there is some correlation between legalizing marijuana use and promoting marijuana use and people who will actually use the substance.